In today's Focus on Your Health, Teresa Snow reports on some new technology that's improving the experience for patients.
Focus on Your Health is sponsored by MU Healthcare.
A former Mizzou athlete is on the road to recovery after being sidelined by hip pain. See how a new type of operating table made all the difference in her experience the second time she faced surgery. For the past decade, Madeline Gerke has been proving people wrong in the pool.
They actually tried to kick me off the Y team. They were like, this girl, not a swimmer.
She landed a scholarship and spent 3 years swimming for the University of Missouri until the pain in her hips became unbearable.
I seriously could not even walk to the grocery store, which is like 2 blocks away from my house, without being in a lot of pain.
The problem was femoral acetabular impingement, meaning the bones in Madeline's hip joint hit each other when she moved. It's likely caused by genetics and aggravated by repetitive motion. Fixing the problem requires a surgery called hip arthroscopy. Madeline had that surgery on her left hip, but was faced with a common side effect afterward.
I had a lot of numbness in my leg for a really long time.
Caused by the traditional operating table for this type of surgery, which uses a post between the patient's legs.
That creates a lot of pressure, a lot of discomfort for the patients, and there's a lot of risk for soft tissue injury, nerve damage, urinary dysfunction, sexual dysfunction.
When Madeline faced a second surgery on her other hip, there was a new option at MU Healthcare's Missouri Orthopedic Institute, a postless traction table.
We're able to tilt the table so that their weight distracts the joint, and we no longer need to use a post. So it's a much safer surgery, it's a much more pain-free surgery for the patients, and they get a quicker recovery.
Madeline experienced no numbness after her second surgery. Today, she's back in the fast lane. And although her competitive career is over, this lifelong athlete isn't slowing down. Joining me now is Dr. Nathan Skelley, an orthopedic surgeon and sports medicine specialist here at MU Healthcare. Wow, what a difference just a table makes. When you saw it, did you realize the impact it would have on your patients?
Absolutely. This table has been a big change in my practice, but it's been a huge benefit for my patients.
Tell me about the condition that Madeline had. Hers was a hip impingement, but do you use it for other conditions as well?
Yes, so I can use this postless traction table to perform numerous different hip arthroscopy procedures. The condition that Madeline had involves the hip bone, which is a ball, sitting within the pelvis, which is a socket. There's a prominent aspect of the bone that when you move the hip, it hits on the cup of the pelvis. So the surgery that I'm performing takes that bump away, makes it into a valley, so that when she moves the hip, it doesn't impinge on the cup. But there's many different procedures that I can perform using this table, including labral repairs, treating cartilage defects, doing bony work. It's a very versatile table that helps patients in many different ways.
And at the same time, you're training other doctors to do the same.
Yes, we're very fortunate to have 2 orthopedic surgery sports medicine fellows at the University of Missouri, and they get the benefit of learning how to use this table as well and observing the different conditions I treat with it.
We're glad you're here. Thank you very much, Dr. Nathan Skelley. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.